Hello, this is Dustin, and this is my presentation on Factor Five Leiden Thrombophilia. And this picture here is a hint of what it is. And so, what is Factor Five Leiden Thrombophilia? Well, it's a genetic disorder that affects your blood, and it does this by making your blood more likely to clot. And this clotting can turn into thrombosis, deep venous thrombosis, or even P's, which is just pulmonary embolisms. And here in this image is a kind of a picture of what DVT is. It causes these massive clots to form in the veins, and then these clots can detach and go further in the bloodstream and cause a lot of problems. And so what causes this disorder? Well, it's actually caused by a single point mutation in a gene known as F5 or Factor 5. And this gene is found in the first autosomal chromosome. And it gets its name because this gene codes for a protein called coagulation factor 5. And as the name suggests, coagulation factor 5 is a protein that causes clots to form or helps assist in the formation of clots. And here's kind of on this side, kind of the right side, kind of an image of what this whole process of clotting is like. So factor 5 would be around here in the middle somewhere, lower area. And coagulation factor 5, it also works hand in hand with another protein called activated protein C, or APC for short. And APC is what causes it to inactivate and stop clotting, stop the formation of clots. But when you have the mutation, the reason you have symptoms is because it can't inactivate, the APC can't inactivate the coagulation factor 5 protein properly. And so that's what can lead to severe symptoms. And the interesting thing about this disorder is it's both a homozygous and a heterozygous mutation. You can have it for whether you only have one copy of the allele or two. But if you're homozygous for the gene, you will be more likely to get the severe symptoms that Factor 5 Leiden Thrombophilia is known for. And so here in this left-hand image is kind of a picture of that of two heterozygous parents. So they each have one copy, but when that will result in one homozygous child, two heterozygous children, and only one being unaffected. And the homozygous one will be the one that will probably get really nasty symptoms. And that leads to prevalence. It actually is kind of a prevalent disorder. It's the most common kind of thrombophilia. And it's mostly common in people of European ancestry. It's not as common in people of other ancestries, and about 3 to 8% of the population with the European ancestry have one copy of the allele. And about 1 in 5,000 will hardly be homozygous and have two copies of the gene. So it doesn't sound like much, but it is pretty prevalent for genetic disorder. And that leads to treatment. And so treatment is typically completed for anticoagulants, although this is mostly given to people who are homozygous for the mutation, as they get the really nasty severe symptoms, or are more likely to get the severe symptoms eightfold. And for those that have only gotten one bad clotting formation or are heterozygous and haven't had any symptoms, they do give counseling on how to limit the factors that could cause clots. As I forgot to mention, but it can also be caused by external factors as well. So your age, obesity, injuries you may acquire, surgeries, smoking, pregnancy, and even birth control pills can activate it. And for women who are pregnant, it actually can be pretty bad because it can lead to miscarriages. But Yeah, so they mostly give counseling and advice for those who are less. And here are my sources, and that is my presentation on Factor Five Leiden Thrombophilia. Thank you.